have hair loss. All is not lost. You gotta tackle it fast, boss. Now, in this episode, I'm gonna talk about some current treatments for hair loss, including medications, procedures, some devices, and possibly what you can expect. I'm Dr. Erica R. Jones, MD. If you haven't already, make sure you subscribe to my channel, like this video, and send it to someone who might need it. There are other videos that I made on hair loss. Make sure you check those out as well. Now, I focus on evidence-based treatments, and a lot of these they focus on slowing or stopping further hair loss, thickening and strengthening the existing hair. As I said before, the earlier you address the issue, the better. Because once a follicle is gone, medications can't revive a hair follicle. Now, there's some medications that you might have heard of, like minoxidil. Now, minoxidil is going to come in a topical and an oral form. Minoxidil increases the blood flow and prolongs the growth phase, and that's usually a first line treatment for hair loss in men and women, but it needs consistent daily use. Now, when you first start as well, shedding may increase briefly. Another medication is called finasteride. It's an oral DHT blocking medication that's FDA approved for male pattern hair loss. It can increase the hair density and slow hair loss. There's also potential sexual side effects, and finasteride is contraindicated in pregnancy. And those are just two of the most popular medications that you can use for hair loss. It's extremely important to know that there are other options that are out there. So for some women who are experiencing hair loss, spironolactone might be an option. Spironolactone is an anti-androgen that can actually help with female pattern hair loss and androgen-driven thinning of the hair, but it's not appropriate in pregnancy. Now, the big thing is that you have to talk to your doctor or your provider about these medications because, you have to have an individualized risk-benefit discussion. Every person is different. Every body is different. So some things may work well for you. Now, there's also some procedures. One of them is called platelet-rich plasma, where your own concentrated platelets are injected into the scalp to deliver growth factors that might, keyword might, stimulate your hair follicles. And then the other procedure is best when hair loss pattern is stable and a donor supply of hair is adequate. I'm talking about transplant therapy. You know, you can watch videos on that. You've seen a lot of the people who are actually going to Turkey to get the hair transplants. But it's important that you evaluate if you are actually a candidate for that. Now, there are some helpful adjuncts, that aren't procedures, like, simple stuff like correcting your iron or vitamin D deficiency if it's present, stabilizing your thyroid hormones, gentle hair care, lifestyle stuff again, avoiding harsh chemicals, avoiding a lot of traction. But you gotta be aware of the expensive miracle shampoos, the expensive supplements, and then just the unregulated creams and lotions and things that people are out there promoting. And you need to understand that there are people out there who are just selling things and they don't even know what these things actually do as far as the science that's behind it. Know that hair loss is not your fault. And in a lot of cases, it's treatable or at least manageable. You have to start to get to know the type of hair loss you have, the triggers that you have, and you got to figure out your options. So if this video helped, if this series that I've been doing has helped you at all, make sure that you share it with somebody. If you have any questions, make sure you drop it down in the comments. Another thing that I really didn't talk about a lot is light therapy. So if you want me to talk more about that, then drop it down in the comments. One of the most important things is that you have to realize that your hair, your scalp are connected to the rest of your body. So your lifestyle matters, what you eat as far as your nutrient deficiencies, all these things, including your stress levels, matter when it comes to how your hair and skin looks and what is actually happening in your body. Just remember, all of it is connected. If you remember that, then you're going to understand how you can help yourself even more in life. I'm Dr. Erica R. Jones, MD, board certified family medicine physician. I'm just here to help you along this road to live the healthiest life that you can live.